Which of the following biochemical pathways is most likely defective in this patient? So what are we seeing defective in this patient? What is the answer to this one? Very good. It is heme synthesis, because what is the diagnosis that is there in this patient? This is porphyria. The most common porphyria in adults, that is porphyria cutanea tarda. So the skin is sensitive to sunlight. Exposure to sunlight gives vesicles and blisters on the skin. Compounds that are subject to excitation by visible light. Okay, so this is porphyria cutanea tarda, the classical image of those blisters, vesicles on the dorsum of the hand, right? So this is heme synthesis. Okay, this is heme synthesis, porphyria. Do you have an acute intermittent porphyria? Is there photosensitivity like this in acute intermittent porphyria? Is there only photosensitivity? Is there no photosensitivity? Is it neurovisceral? What kind of porphyria is acute intermittent porphyria? Very, very important point to be remembered. Remember, in acute intermittent porphyria is only neurovisceral. Very, very important. There is no photosensitivity in acute intermittent porphyria, which you get in cutanea tarda. Okay, cutanea is cutaneous only. There are no neurovisceral there. We have discussed the topic of porphyria, is available in the Radsynapse app in the main videos. Biochemistry, do watch there. Okay, so very, very important to remember the enzymes, right, which is dominant, which is recessive, what are the manifestations. This is how the image is given on the dorsum of the hand, porphyria cutanea tarda. There is this lesions here. The enzyme deficient here is uroporphyrinogen decarboxylase. Okay, decarboxylase, C for cutanea tarda. And there will be tea colored urine here. Okay, there will be tea colored urine because of uroporphyrin. Blistering cutaneous photosensitivity, most common porphyria, which can be precipitated by alcohol, also associated with hepatitis C. So sun avoidance, antimalarials like hydroxychloroquine can be given. Look at this heme synthesis pathway, your snippet from the first aid. Glycine is important for heme synthesis. The rate limiting enzyme is ALA synthase. Vitamin B6 is required for that. So when this is deficient, there's going to be sideroblastic anemia, X-linked. Then you have ALA dehydratase, which is inhibited by lead poisoning, and also ferrochelatase inhibited by lead poisoning. Then you have acute intermittent porphyria, which is porphobilinogen deaminase, which is affected, or which is uroporphyrinogen 1 synthase. Okay, 1 synthase. Then you have porphyria cutanea tarda, where you have uroporphyrinogen decarboxylase, which is affected here. Right? Is this clear with everyone? So you can see that here it is starting in the mitochondria and then it is going to the cytoplasm. So heme synthesis is something which is hug. Both the mitochondria and cytoplasm is required. Starts in the mitochondria, goes in the cytoplasm, comes back to the mitochondria. Ferrochelatase, ALA synthase are here in the mitochondria. Okay. So protoporphyrin is the last one. First is the uroporphyrinogen, then coproporphyrinogen, and then protoporphyrin, UCP, uro, copro and proto. We have discussed the other various types of porphyria, variegate, congenital erythropoietic, all of that we have discussed in our, yes, very good. So you remember the mnemonic, Kartika, very good. You remember mnemonics very well. ER is AR, okay, erythro wale autosomal recessive hote hain. Absolutely right. Remember the association of cutanea tarda with hepatitis C. Okay, remember the association with hepatitis C. Right, so those were basically your fast 5 for today. Quickly revising in one-liners, what did we see today? What was the first question that we saw today, guys? Let us see a quick recall of whatever the 5 questions. The first one was meningioma. Meningioma arises from the meninges. Can you tell me the tumor marker for meningioma? Immunohistochemistry? Is it desmin? Is it vimentin? Is it cytokeratin? What is the tumor marker for meningioma? Oswald, absolutely right. For AIP, the mnemonic is PIH. The enzyme deficient in AIP, it is PIH. बताओ मुझे ट्यूमर मार्कर क्या है मेनिंजियोमा वाला? इट इज विमेंटिन. रिमेंबर MEME. Meninges, mesenchymal, endometrial is vimentin. Okay. What was the next question that we saw, guys? We have the 5 questions for today. What was the next one that we saw? एक था meningioma. What was the next question? Yes, quickly. So there was one question on asbestosis, the question on mesothelioma. Okay, the question on mesothelioma, asbestosis, shipyard working is the important risk factor there in asbestosis. What was the next one? The last one we saw, we remember because we have seen just now, is porphyria cutanea tarda, increased sunlight sensitivity, right, excited by light, that is what we saw. And what were the middle 2 questions? Yes, Lambert-Eaton syndrome and your myasthenia gravis. So we had seen a question on Lambert-Eaton where on repetition it improves. Okay, it improves on repetition. There is proximal muscle weakness. There can be autonomic features. The deep tendon reflexes are depressed. It is presynaptic calcium channel. And what was one more question, the 4th question there? Yes, what was the 4th one? Brief psychotic disorder. Very good. One was the brief psychotic disorder. Duration less than 1 month, similar to schizophrenia, but the duration is less than 1 month. For schizophrenia, the duration should be more than 6 months. That is when we call it schizophrenia then. Brief psychotic will have hallucinations like schizophrenia, but it will be less than 1 month. Okay, it will be less than 1 month. So this is where I have given you the summary, right, so that it's easy for you to revise. And you'll get the annotated PDF also along with the test series is where I'll replace the blank PDF with the annotated PDF for you guys to revise, so that once you have given the test, later on once we finish the sessions, you can revise the PDFs from that test series section in the Radsynapse app by Dr. Nikita. And when are we meeting next? We are meeting next in the